Hello and welcome to The Changing Paradigm. I'm Dr. Patricia Hill, and today my guests are Dr. Gail King and Dr. Fouad Ghaly, who are the co-founders of something new in Aspen called Regen. It's a regenerative medicine clinic. Welcome to the show.
Thank you.
Thank you, Patricia. Thank you for having us.
You're both very outstanding in your fields, and internationally known Dr. Ghaly is known all over the world and trained all over the world in various specialties of medicine. Dr. King has been in Aspen for how many years?
9 years.
9 years, and is a board-certified OB/GYN, but now moving into this new field of regenerative medicine. So maybe you could start off by telling us, what is regenerative medicine?
You want to take that one?
Yes, of course. Regenerative medicine, we enhance the regeneration of the human body to enhance its brain function, our quality of life, and our sense of well-being, and protecting the brain from, the deterioration that takes place as we age. So we protect, of course, the body, the organs, the physical function, as well as the mental function. When we do that, we enhance the quality of life as well as the productivity of the individual.
When you say you protect those things, you mean that you keep them from deteriorating, or you can regenerate them to their functioning?
Correct. As we age, after the age of 20 or so, there is always regeneration of our body, even to the 80s and 90s. However, the regeneration had slowed down gradually until it comes to be minimal at best.
That's a little discouraging, but we all know that's true, that we reach our peak probably at about 25 or so, and then it's just kind of a long, slow slide down from there. But you have many ways of either preventing that or regenerating those functions. And Dr. King, you have your own specialties within that. You've been dealing with women, obviously, and so you're concentrating a lot on some of the beauty aspects, the regeneration of the mind, body, and spirit of women, but also working with men in this, and including the sexual functions of women.
That's very, very true. So, like you said, I am traditionally trained as a gynecologist. And so my first interest was the gynecologic health of women. My specialty is pelvic repairs for women. Oftentimes after they have babies, the vagina becomes laxed, and we can repair that and put them back to how things were before they had babies. And I have taken that a step further. I do an advanced repair, and we actually add platelet-rich plasma to that repair in what we call a vaginal Regenilift.
We're going to be talking about that platelet-rich plasma, which is the basis of a lot of the work you do, although you have a whole huge list of regenerative techniques that you use. But using them in combination is really quite interesting. Tell us, Dr. Ghaly, I have actually had the PRP injection, so I can testify to how amazing they are. What is platelet-rich plasma?
Platelet-rich plasma, it's the plasma of your own body. It's a component of the blood that we isolate, and we just take away that portion of the red cell mass and the white blood cells as well, and we just only separate the plasma that is rich in platelets. Per ml of our blood is about 300,000 platelets. However, when we concentrate it, it goes up to 5 million per ml in the plasma.
And the platelets are involved in repair of the body.
Exactly. It's involved in repair, as well as it has many growth factors, as well as the plasma itself has growth factors. And these growth factors go and trigger the growth factors for the dormant stem cells under your skin to enhance the function of those stem cells that are laying dormant and kickstart it to produce new collagen and new elastin and new skin instead of sitting dormant.
So basically this stimulates your own stem cells.
Exactly.
So there's no controversy about where those stem cells came from or any of that. It's your own stem cells.
Yes.
And you injected both of my shoulders. I have had serious tears in both of my shoulders, my rotator cuffs, to the point that I've had to give up a number of things like tennis and golf and even skiing. I was warned not to ski because I had a 98% tear that could tear the rest of the way. And actually, after one injection of PRP, I noticed a huge difference in my most serious shoulder, which you injected first.
The right side.
You know, within a few days, I had a much larger range of motion. The pain was gone. And then you injected my other shoulder, and I'm excited. I'm having just almost back to normal functioning. So whatever it's doing in there, I guess it's repairing the damage. I was scheduled for surgery, and I didn't want to do it, so this is a great alternative. But it's you do more than that with the PRP. You can use this for the healing of injuries, but you can also use it for regeneration, for instance, of the face.
Yes, indeed.
Which you also did on me.
Yes.
And I noticed a nice difference from that too. You apply those stem cell or the plasma to the skin and then get it to absorb into the skin, which, as you said, it creates more collagen and plumps it up, does all sorts of amazing things. And which brings up some other things that Dr. King is doing, the tripolar. Mm-hmm. Would you tell us about that?
Sure. The tripolar is a machine that uses radio frequency, and it has 3 poles to it. That's the name tripolar. And the energy transfers between those 3 poles. But it would heat up the skin and the dermis to, we like to get it between 30 and 35 degrees Celsius, sometimes up to 40. For a certain amount of time, and that stimulates, again, those stem cells, but also our collagen to form, and it tightens the skin, reduces wrinkles, can reduce cellulite, things like that. So it can be used as a treatment throughout the entire body, on the entire body.
I was reading your material, and it also can shrink your fat cells. So
it can by heating them up and causing them to release their fat, and then your body reabsorbs that.
Well, that's pretty exciting.
It is great.
And I've actually, I had one short little treatment of that, and I could even see some difference from that. But I have had the chance coming to your office to see people who have numerous treatments, and they look unbelievably much younger and more
it's exciting.
Vital and radiant.
It's definitely exciting. We're getting great results. Faces, legs, arms, back of arm, that's a really hard area to treat.
Those
that little bit of skin,
bat wings.
That little turkey waddle.
You can get rid of those?
Yes.
Oh, well,
it tightens up there very nicely.
Again, you know, I know women who've had surgery on those and they have a horrible scar, and, you know, it's not a good alternative. Yeah. So you're actually getting the body to regenerate itself.
And that is the whole concept, is that we are using the body's natural ability to repair itself and to regenerate through stem cells, but also stimulating those growth factors. To have the body's an amazing organism, and it's able to repair a lot of things. We're just encouraging that and using that natural ability to do that.
Well, this fits right in with my philosophy that you do exist in a whole and perfect state, but that various things interfere with that, but it's always available to you. You can always go back to that whole and perfect state in the mind, body, and spirit. So you seem to be finding many different ways to help people to do that. And you have many, many different ways. So maybe we could talk about some of the other applications that you have. you're doing everything from hormone replacement to some work with nutrition, detoxification. You can tell me better than I can recall. I have 3 pages here of things that you are doing. So maybe you could talk about some of the other approaches that you're using. I know there's something called EECP that sounds very exciting. Maybe you could give us a little description of that.
Yeah. EECP is a marvelous treatment, as a matter of fact. It's a phenomenal way of regenerating your entire body. If there's any machine that you will call a regenerative machine or rejuvenation of your body, this machine will be it. This machine was approved by the FDA in 1997 to treat patients with angina. In other words, people that develop chest pain due to inefficient or insufficient blood flow to their myocardium. So the heart is complaining about the fact it's not getting enough oxygen or nutrition. And it generates new blood vessels in the myocardium, so much so that actually bypass these narrow blood vessels.
So if you have narrowed blood vessels from plaque buildup, for instance, it can actually grow a whole new vessel right around that.
Exactly. It actually generates new blood vessels de novo, in other words, brand new, which is called new angiogenesis, new blood vessels. Angio means blood vessels. And not only this, but actually it increased the VO2 max in patients with congestive heart failure. So VO2 max is the gold standard of measurements to find out whether an athlete will go and get the gold medal versus the other athlete that will not get the gold medal. But in the same time, they were in the same cut. And in Boulder, Colorado, they have that human performance lab for the Olympics. And
I've worked with them.
And then they actually measure the VO2 max. So,
well, that's something new since I was associated with it, but obviously this is a new technology.
yes.
So it actually, besides being applied to people who might have heart disease or some circulatory issues, it can be used for enhancement of performance?
Yes, it increased the performance of an ordinary athlete. Any human being will benefit out of it. Take, for example, a cyclist will improve his cycling ability. It will eliminate the fatigue and the tiredness and the recovery period. Shorten the recovery period the next day almost totally to nil. It actually enhanced the brain function because it increased the carotid blood flow. It increased the blood flow to your kidneys, to your liver, to down your periphery, down your legs, everywhere in your body. And the more you increase that blood flow to your entire human body, the more you enhance the function.
And that's not illegal.
It's not illegal.
That's,
and it's not doping.
The doping issue is very big in
not at all.
competition.
And how many patients have received the clean bill of health and nonetheless they keeled over and died? One of them is Tim Russett.
Yes.
And the other one is Bill Clinton. And I have a name for that. It's called the Clinton syndrome. And it has nothing to do with Monica Lewinsky, by the way. just to kind of tell you that.
Speaking of Monica Lewinsky, this may be a little risque, but I understand that this technology can be used for erectile dysfunction.
It does, indeed, because it increases the blood flow to all organs of the body, including the function of women as well.
So you're both dealing with the sexual health issues on some level, which is...
At the center, we have this machine, and it takes 1 hour of treatment, and it's all monitored, the electrocardiogram, the pulse oximeter, the plethysmograph that we measure the blood flow to the entire body. So nothing is not monitored.
Well, this is all very
It's
high
FDA
tech,
approved.
very cutting edge, and we're very fortunate to have it here in Aspen. Why did you choose, Dr. Ghaly, to come to Aspen? I know you have your Ghaly Center for Regenerative Medicine in Los Angeles.
Yes.
Why Aspen?
I came out here kicking and screaming, as a matter of fact, and they twisted my arm.
Oh, I'll bet. Yeah. Sure.
And after I came here, it just became like home, and thanks to Dr. King. And you know, when I don't come, I have withdrawal. So.
Oh, well, we all feel that way. In fact, we have to warn you that once you start coming to Aspen, you have to stay. It's a well-known syndrome, yes. So, well, that sounds very exciting. And again, getting the body to heal itself. There's nothing artificial, nothing chemical, nothing pharmaceutical even involved in this. It's your body healing itself and regenerating itself.
If I may add, Dr. Hill, one thing is that there was a paper that came out of Israel that they were able to identify new cardiomyocytes in the heart after you know, a course of treatment on EECP. So that by itself proves to us that the body responds to other things to produce its own stem cells. So,
and it does, there is a specific thing that the body produces. I have so many notes here, I've lost track of it, but something that can be measured.
Nitric oxide, to increase nitric oxide.
Yes. And what is the function of that?
Nitric oxide is a neurotransmitter and was discovered in the early 90s. And the scientists that actually identified in our body received the Nobel Prize, because the nitric oxide is a phenomenal neurotransmitter that will actually does vasodilatation, what you call endothelial function of the body. It controls blood pressure and perfusion of different organs. It vasodilate the coronary arteries as well as other parts of the body, including the sexual organs. So, and the nitric oxide is the substance where Viagra was built on.
Is that right?
Because Viagra.
So this is you're getting your body to stimulate your own Viagra.
Exactly.
Well, science has come a long way, hasn't it? And back to the beginning, really, of taking this long detour through thinking that we could have better living through chemistry, and now we're coming back to having our own body produce its medicine, which is really exciting to me. I see, again, you know, lists and lists and lists of things here. And one of the interesting, or the enemy number one that you called it in your material is inflammation and oxidative stress. That is what causes aging, correct?
Yes, yes. I always say public enemy number one is inflammation. So it's inflammation, inflammation, and inflammation. Cholesterol is not the issue. It's the other factors that play a role to cause injury to the endothelial lining of our blood vessels. The largest organ of our body is not the skin, it's the endothelial system. And when there is an injury to the endothelial lining, the mast cells, certain specialized type of cells of our blood, and leukocytes and this and that, come to repair that injury. Meanwhile, as it's being repaired, then cholesterol, triglycerides, lipids, and this and that adhesions form in that area. So it narrows the blood vessel. And that blood vessel doesn't narrow over a period of a year or 2 or 3. It actually takes 10, 15, 20 years to actually reach a critical momentum for a disease to manifest itself as clinically. So the issue here is not to treat the disease after it happens. It is actually prevented early on. Otherwise, you're missing the boat.
Well, it's always harder after the horse has left the barn to get it back in, you know, than to keep it from from going. And I know, Dr. King, that you're doing some interesting things with supplements, in fact, to help with this sort of thing, oxidative stress, and and measuring things like cortisol, some of the stress hormones. And of course, all of this is also related to, besides anti-aging, it's related to addiction and depression.
Yes,
correct?
all of that is true. If we could break it down just a little bit, our approach really is to, at first, to measure and see what each individual is lacking or maybe have adequate levels of. You know, we believe in measuring and not guessing. You know, test, don't guess.
You do some extensive testing, in fact, before you treat people.
Very much so. And tests that are not generally available at other practices. For example, we can do vitamin testing to see on an intracellular level if you are getting enough of vitamins. Are you absorbing them? And it's not really what did you eat yesterday, it's a look at you, a snapshot over the last 3 to 6 months of what actually is getting into your cells and your body's able to use. We also do telomere length testing, and telomeres are the ends of our chromosomes, and it's a repetitive sequence of DNA that acts as a protective cap for the rest of the DNA. And every time that the cells divide, you lose a little bit of that sequence, that telomere length. And it also acts as the time capsule of how long you're going to live, because when those telomeres get critically short, that's the signal for the body that those cells will then die or become senescent and not work properly. So it's possible to look at how long your telomeres are. Your chronological age, based on when you were born, may be one thing, but your biological age could be entirely another. You could be 40 years old from your date of birth, but it's possible to be 60 or 70 years old based on your biology or your chromosomal biology.
I can vouch for that. I just came back from my class reunion, and that's a good opportunity to see how people age differently.
Right.
Some people look the way they did in high school, and some honestly look like they're 100 years old. But this is the result of your telomeres shrinking. I found that really very interesting. That's a genetic testing that can be done, and these telomeres can actually be lengthened again. You can get them back to close to their original state.
And with the telomere length, like I said, it is a really good snapshot of where you are right now by your biologic age, how old you are, your tissues are. Yeah. There is a gene called the telomerase gene that can re-lengthen these telomeres. Those are generally only active in our stem cells, our germ cells, and to a limited extent in our immune system. But there are certain things that can transiently turn that on in the rest of our cells. And some of them are supplements, diet, exercise, and things like resveratrol, things like that can also help as well.
And you have some specific things that you do. There's an amino acid drip that you use, and various kinds of injections, and
there's a couple of them. The first one is an amino acid drip, and it was originally developed by a Dr. William Hitt, and he chose to go to Mexico because he wasn't able to find a lot of scientific interest here in the United States. And he developed these amino acid drips to help people initially with addictions, any addiction whatsoever. It could be alcohol, narcotics, tobacco, gambling addiction. And he found that the neurotransmitter receptors in the brain were becoming damaged by any substances that you've been exposed to in your lifetime. And some people find it very, very difficult to come off of these substances. But even if you have and have just been exposed in the past, those neurotransmitters have been damaged. And by using the amino acids as a substrate, you can go in and repair those neurotransmitter receptors. And we're able to take people who have addictions and over the course of a 10-day period, get them entirely off of whatever substance they are addicted to and fully repair those receptors.
That is pretty dramatic, a 10-day period, and you can turn an addiction around. And also, I understand, well, of course, the amino acids are related to depression as well.
Absolutely, and all through that. there's another therapy that we're also starting as well, which is a phospholipid therapy. Every cell membrane in the body is made of a bi-layer of phospholipids. And that lipid layer especially, that's where we'll oftentimes attract and toxins will lift, things like mercury toxicity, organic pollutants, viruses oftentimes will attack there as well, and they can damage that lipid layer. And the phospholipid IV therapy can go in and get rid of that lipid damage, and it's kind of like an oil change for the body.
And the loss of the lipids is related to things like MS and
Exactly.
Parkinson's and all those things in which you lose that fatty coating.
Exactly, exactly. And so this is a therapy to help with that as well.
Pretty exciting. So let's see. What have we not covered here? You have many other things that you're doing. Oh, in fact, I am aware that you're also doing chelation therapy to help people to detox.
Dr. Ghaly actually does IV chelation, and I do oral, mostly oral chelation for heavy metal toxicity.
And that is with, what is the substance that's used for that?
Chelation was introduced by the Department of Defense or the military in Britain during World War II because of lead overload, and of course that caused brain toxicity and liver toxicity, etc. And they used an amino acid called EDTA, and that to eliminate or to wash out the excess lead.
That binds the heavy metals.
Exactly. And then you excrete it. We have to check the kidney function before we do that. So this is a legitimate way of actually treating heavy metal toxicity. Living in our environment, there is always pollution, whether we like it or not. It's just given. Of course, here in Aspen, we're blessed that we have lower level of pollution.
That's why we're all here.
However, in other parts of the country, like for example, in Jersey or in Ohio, or in the higher the industrial, pollution, the greater the people will absorb these heavy metals.
And even things like automobile exhaust.
Of course. Catalytic converters as well.
Right.
Yeah. So because of that, we don't know, because all that toxic heavy metal is stored in our fat. And
it's very hard to get out.
Exactly.
Or it doesn't come out, basically.
Exactly.
I know this because I have had chelation therapy. I had to go to Germany to do it because it was illegal in the United States up to a certain point. It has now become legal. But I went through extensive chelation therapy at the University of Munich Toxicology Center, and it's miraculous. Again, it's another thing that's just life-saving.
Another metal, heavy metal as well, is mercury. And more our oceans are being polluted with mercury due to industrial waste, etc. And one of the things that we consume out of good health habit is high amount of fish.
Which are high in omega-3 fatty acids and have all kinds of wonderful benefits. But unfortunately, as you said, that there is now the risk of mercury toxicity in fish.
Yeah, and I had a patient that she ate, all her protein intake was made out of fish, and because of that she had very high toxic overload of mercury, and she had all kind of vague, unidentifiable symptoms, but she was obviously very ill and sick.
That's mercury toxicity is one of the things that's involved in depression, for instance, or other kind of neurological problems, brain function, and it goes undiagnosed. People don't know that that's the cause of what's going on with them. So you can test for that?
So yeah, we can test for that in the urine, and we challenge their body so as we can pour out whatever stored, and then we measure in the 24-hour urine.
Right.
and we can chelate the mercury out. And as a result of because of that, the patient feels improvement in the function and behavior and the way of thinking and memory, et cetera, et cetera.
So that's called provocative
chelation.
testing, and I went through that as well. You actually go through a round of chelation therapy and then test the urine and whatever to see what comes out, and can be pretty shocking. Most of us are much more toxic than we realize.
And what's very interesting is that every individual is going to be unique in their capacity to do their own detoxification. If you have two people who are next to each other and have the exact same exposure, one may go on and become very, very toxic and have a lot of untoward sequelae, and the other person may be fine. And that has to do with their own innate ability to do detoxification on their own. And sometimes that's a genetic thing, and sometimes that's a lack of vitamins or things like that. So each person is going to be individual, and so we want to be looking at that person and find out what it is uniquely about them that they need. And so each person is treated individually, not just you have this and therefore you're going to get this next treatment.
Well, everybody is not created the same in
Exactly.
any kind of way. And in fact, I call myself the canary in the coal mine, because I'm one of those people who I don't seem to have defenses against toxicity. So it's very easy for me to become toxic very quickly. And so I have to constantly detoxify in my own kinds of ways and seek things like chelation therapy. But I'm living proof that it works, because I was so toxic that I shouldn't have survived it. Wow. So I highly recommend that as well. So here we are. We're going down our list here. We have talked about genetic therapy. You also do some injections, Dr. Ghaly, which I had. Could you describe that a bit? That's a combination of things that help you to regenerate your body.
We focus on stimulating your own growth factors to, in turn, of course, in activating your own cells to function better and feel and think and behave in a younger age rather than your present age. So it enhances your vitality, your sense of well-being, your focus in the brain, even your entire function. So this is another modality that we do. I use glutathione, for example, intravenously, and it is one of the best antioxidant there is, and it's great for the brain function. I use alpha lipoic acid intravenously as well, and it is great for detoxifying liver, even if the person has been heavy drinker, that the liver became affected. So it decreases and it improves. The liver is one of the most fascinating organ because it has regenerative property all the time.
You grow a new liver every
all
7
the time,
years
yeah,
or something
exactly,
like that, right?
and brand new cells. So when we enhance these cells' ability to function better by providing the internal milieu of the extracellular fluid, improvement, therefore these cells flourish much better.
So
the Germans have used alpha lipoic for many years with phenomenal results. So we have a host of injectables to promote
well, I
the
must
well-being.
say, I felt like a new person after just one injection, in fact. And as you were saying, it makes you feel younger, so then you act younger, you think younger, you look younger, and that all kind of goes together to help you to regenerate too. It raises your spirit. And speaking of spirit, you are doing some things with that as well. You're introducing some meditative techniques.
Well, we will be having people in our clinic with more of an Eastern medicine philosophy. We have an acupuncturist and a massage therapist and we're open to having other modalities other than that traditional Western medicine available in the clinic.
So you are truly holistic. You know, people have talked about holistic medicine for years, but they haven't really done anything with it.
Right.
But you've got it all available right here in your the Regen Center in Aspen. Are these treatments expensive? Are any of them covered by insurance, or are these things that are out of reach for
you
a
know,
lot of
it
people?
comes in a variety of price ranges. The testing, some of the testing might be covered by insurance. Telomere testing, for example, is not covered by insurance. No insurance has recognized that. When it comes to the therapies, a lot of what we're doing, because we're doing vitamin therapies and things like that, the FDA does not regulate that. It's not a drug. And therefore, it's looked at as supplement therapy, and most insurance plans don't cover supplement therapies. But you know, the price range is all over the board.
Well, I understand if Obamacare is instituted, that it does cover more of the alternative medical
I'm not
procedures.
aware of that. So.
Oh, really? Well,
yeah.
that was something that I read, that it would cover more of what were considered to be alternative treatments. So,
This would be a step in the right direction.
It would be a step in the right direction. There have been many studies done on these kinds of modalities, and they are incredibly effective, obviously. So it seems that it could be used to prevent people from becoming ill, and illness, heart disease, all the things that we've talked about take such a toll on our society and our economy. It only seems logical that we should try to help people to prevent these illnesses and to regenerate themselves when they develop them. Pharmaceuticals are great, but they don't address the cause. They just usually work on the effect.
Traditionally, traditional Western medicine is a disease-based model. And what that means is that we are oftentimes waiting till somebody develops a disease and has all of the full-blown symptoms, and then we're able to say, oh yes, you have this. And then traditionally we would prescribe medications that would address the symptoms. For example, if you wait till somebody has high blood pressure, and then you would give them a medication that would bring the blood pressure down. The question we want to ask is, well, why did you develop high blood pressure in the first place?
Right.
And if we can address it at that level and figure out what it was that caused that in the first place, and we're addressing it at its root cause, then maybe you're not going to have a medication. Maybe we're eliminating it, or reversing the process altogether. We're not throwing out traditional Western medicine. Both Dr. Ghaly and myself are traditionally Western trained. We're just adding to that and going at a deeper level.
Well, it's complementary to the traditional medicine. But one of the points that you brought up there is that, by the time people are usually diagnosed with something, it's almost too late. They're probably 80-90%
Correct.
Down the road
Absolutely.
with it. So with your testing and the preventive methods that you have, you can catch it a lot earlier.
Well, we're looking for trends before they ever become evident in symptoms. Even through a simple blood test like a health profile that most people hopefully get through their regular physician, we're able to look through that health profile with a fine-tooth comb and with a different eye. I'm not looking at what the lab considers normal. I'm looking at it and saying, well, what's an optimal level? For example, glucose, a fasting glucose, the lab considers up to 99 normal. Well, by the time someone has a fasting glucose of 99, they are actually insulin resistant and
they're
maybe
on the edge
pre-diabetic.
of diabetes at
Exactly.
that point.
And in fact, for every point above 86 that a glucose is elevated in a fasting state, there's a 6% risk of developing diabetes in the next 10 years. So if you have someone who has a fasting blood glucose of 96, that's a 60% chance of developing diabetes in the next 10 years. So we're looking for those trends early on and trying to prevent it. If you can catch it really, really early, we may be able to reverse it and prevent it altogether.
Well, in fact, by the time it gets to those points, it's almost impossible to turn it around.
It's caused a lot of damage in the body.
Yes,
and that's
a lot
where the
of
symptoms are
collateral
finally coming
damage.
in.
One thing we did not actually talk about is you do some hormone therapy, hormone replacement, which is a little different from what we think of in terms of hormone replacement therapy that is used by most physicians.
Well, Dr. Ghaly and I both believe in bioidentical hormones, and that basically means that those hormones are the exact hormones your body used to make if it's not making enough of its own. We do like to say that they are synthesized in that we oftentimes take soy or yam and then they are modified until they are the exact hormones that our body produces on its own, as opposed to using something like horse urine, which is very natural. However, it is not identical to what the human body should have. So we believe in using bioidentical hormones and not the non-bioidentical. I think it's also really important to know that women who come to me and who are afraid to use hormones, almost every single woman asks me, am I going to get breast cancer if I take these hormones?
Yes.
And there's a huge correlation between synthetic progestins, norethindrone, Depo-Provera, just Provera itself, with an increased risk of breast cancer, not bioidentical progesterone. And unfortunately, a lot of our literature is using progesterone and progestins interchangeably in their verbiage, and it becomes very, very confusing to a lot of people. But it does seem to be that the progestins are one of the biggest culprits in that increased risk.
And do you do hormone replacement for men as well? Or
yes,
only for
absolutely.
women?
Both of us do.
So what kind of hormone therapy is used for men?
Hormones are essential for our entire body function. For example, a patient comes in with high triglycerides and high cholesterol, and his thyroid function is within normal limit according to what we read. And wouldn't you know it, just like Dr. King says, it's the trend. So all of a sudden, if you correct his lazy thyroid, in spite of the fact that it's quote unquote between the two brackets that it is normal, actually you lower the triglycerides and lower his cholesterol without giving him any statins.
So it's all interrelated.
Absolutely. Not only, again, testosterone decreases in men and in women over time. And as the testosterone goes down, then we develop what you call the midlife crisis, or the syndrome X, or the problems that we have, increased abdominal girth and weight gain and lack of focus and concentration and interest in life and all that.
And that's all a result of the lack of testosterone.
Testosterone is the joy of life for men and women, both.
Yeah, most people just think of that as a male hormone, but it's actually for women as well. It helps
Indeed.
to increase their vitality and energy.
It increased the
and
focus.
Sexuality.
Not only this, but increased the brain focus for men and women.
I have actually taken testosterone myself, so I can testify to that. It made me feel fantastic. I think women are afraid of testosterone because they think they're going to develop some male characteristics or.
Well, when we're prescribing testosterone, first of all, we are going to be doing testing, and the kind of supplementation that we give women is based on a level that is a normal level for a woman. We don't believe in giving supra-physiologic levels that are above what a woman should be making normally.
So women do produce testosterone.
Absolutely. And so we're going to be getting them into that optimal range for a woman. I certainly am not going to prescribe a level that would bring her up to that of a man, because that would have
she would
side
grow
effects.
a beard.
Correct. And most women don't come to me asking for that. So.
Yes. Really. Well, in fact, in your literature, we have so much here. I see that you said that thyroid is really the most important thing in all of this.
Yes, of course. Thyroid is the primary gland in the body, and when we are not cognizant of the subclinical hypothyroidism, we are missing a major role of a gland that plays in our well-being, whether it is from depression, from presence of mind, and ability to maintain our healthy being as far as average weight and height and all that sort of thing. All that is dependent on thyroid. And then lack of sleep at night time. Women that are marginally low thyroid, they can't sleep at night, and they burn the candle at the end of the day and at night, and then they go to bed, and when they wake up, they can't get up out of bed, and when they get up, they are tired and fatigued, and but they say, oh, we are nocturnal, or we are night animals, or or I get my second one late in the day.
Some kind of excuse.
Exactly. But
Yeah.
indeed, it is due to low thyroid function. We have fluoride in every form, in whatever we intake, and fluoride.
Water.
Exactly. And fluoride is the king of the halogens. And if you are a king, you ask the iodine to move over, and iodine is the element that the body uses to form thyroid hormone.
So fluoridated water is actually one of the causes of low thyroid.
It causes depression to our kids. As a matter of fact, it dulls their brain. Of course, it gives them great teeth, but in the same time, it dulls their brain.
As I've told you, my daughter lives in France, where they do not fluoridate the water. And I've noticed that in France and Europe in general, there's no ADD, there's no ADHD, there's not so much depression, nobody's fat, so that is maybe a big factor in all of that.
I mean, you can use fluoride on the teeth as a treatment, fluoride treatment on the teeth, but you don't have to give them fluoride.
You don't have to drink it.
Yeah, and every day.
Yes.
You don't. So what happens is that the fluoride takes place, or move over, which is the iodine, and it takes over, and therefore the thyroid becomes hypothyroid all the time, because it doesn't have adequate iodine to manufacture the thyroid hormone. And thyroid hormone is made out of triiodothyronine, which is 3-iodine plus the thyronine, which is an amino acid. So because of that, we have we have a belt called the iodine, low deficiency iodine belt, which is in the middle of the United States.
Well, they're far from the coast, so they're not getting the iodine.
And most of these patients have goiter, are a little bit obese, et cetera, et cetera. So iodine and thyroid and what we eat and what we drink plays a major role in our well-being.
I just got something on the internet yesterday, an article on how fluoridation contributes to Alzheimer's, because it allows aluminum to collect in the brain. Do you know anything about that?
That I'm not. It could very well conceivably be possible, but I don't have that literature, nor I have come across it.
I'll send you the article.
Okay. Yeah.
We are actually getting to the end of the show, surprisingly. I still have a whole list of things here that we did not talk about, but if people are interested in knowing more about these therapies, or in coming for some treatments, how would they get in touch with you?
Well, they can actually call our office. My primary office, the number is 925-8005, and we can start there. And Dr. Ghaly is in town approximately once a month. If they would like to see him, we can get them an appointment with him, or they can get a consultation with me, either one.
Good. Dr. Ghaly comes here from Los Angeles, where you have your own regenerative medicine practice.
Yes.
Doing all these things.
Yes.
And you will be coming here on a regular basis to do
I have
those.
been, yes.
You have been. And I understand you've actually sort of turned your whole women's health clinic over now to regenerative medicine.
That's right. We're in the middle of transitioning that, and that is what Regen Aspen is. It's a combination of, it's for men and women. Men were a little uncomfortable coming to the Vaginal Rejuvenation Institute.
Yes, I suppose they were.
So and because our focus now is really both men and women, the whole body, we are transitioning into Regen Aspen.
So you have actually taken over the building where you were, and you're converting this into a state-of-the-art
The
facility.
entire first floor, and we will be remodeling very shortly.
And where are you located?
605 West Main, 2 blocks down from the Hickory House.
Wonderful. It's a very nice place, great environment, and people walk out of there smiling and happy and looking vital and alive, and it's really quite wonderful and very exciting to have it here in Aspen, so easily available to us. So I would like to finish this show by again telling you that my guests have been Dr. Fouad Ghaly, who is has his own clinic in Los Angeles, regenerative medicine practice there, and Dr. Gail King, who has been known in Aspen as an OB/GYN, specializing in vaginal rejuvenation, and now combining their services to offer all these amazing regenerative techniques to us all. Thank you so much for what you're doing. And thank you for being here on the show today.
Thank you, Dr. Hill. Appreciate it.
Thank you, Dr. Hill.
And thank you all for joining us today. Please join us next time for more exciting developments.